So, chapter 13 talks about the nervous system medications. So first I was going to talk about just the actual nervous system, and I found this wonderful little video to go with it. It'll probably be super loud or super quiet. Let's see.
Oh man, so is that a bus? Oh yeah, I hear it too. Bugging me out. How am I going to learn about the nervous system if that's in bugging for?
It's Flow Cab at your service. Listen, we're here today to talk about the nervous system.
Hey, wait, hold up, stop the song. Something big just landed on my left arm.
How does your brain know what your senses feel, huh? It's your nervous system getting the job done. Don't think you have nerves in your skin? Well, you're wrong. And nerves are made of bundles of neurons, specialized cells that carry messages fast, believe it, and they don't even need a messenger bag. Most nerves connect to the spinal cord. Its mission is to act like the highway of your nervous system. The spinal cord zooms the message to your brain, which unpacks the message and tries to explain what it means, and the brain controls your response. In this case, it says,
move your left arm.
That message goes back, spinal cord to nerve. The arm moves, you squash the bug in a blur. Word, the central nervous system is the name that pertains to your spinal cord and your brain. And the other neurons and nerves in a different position, they make up the peripheral nervous system, abbreviated as CNS and PNS. Saying the full lines will leave me out of breath.
Chilling with the systems, I'm like, oh hey, who's this with the neurons, spinal cord, and brain? Controlling everything I think, do, and feel.
That's the nervous system, y'all, you know the deal.
Chilling with the systems, I'm like, oh hey, who's this with the neurons, spinal cord, and brain? Controlling everything I think, do, and feel.
That's the nervous system, y'all, you know the deal. The peripheral nervous system has two functions, so we can divide it into two parts. The somatic nervous system part runs all voluntary actions from the start. It sends info to your CNS, then receives messages, makes your muscles flex. That's what happened with the bug before. That was your somatic nervous system.
Yeah, sure.
And there is a kind of involuntary action that the somatic controls. Here's what happens. If you touch a pan that is hot, a reflex takes place, an impulsive shot to your spinal cord through sensory neuron. Another impulsive shot back through motor neurons shifts your brain so your reaction's fast. That's the somatic system and its various tasks. It's another crucial part of the PNS. The most involuntary actions get done by the autonomic nervous system. It's active even when you're still or asleep on a mattress. It regulates your body's internal machines so your heart always beats and you always breathe. It's in charge when you cough or sneeze, when your pupils expand in the dark to help you see.
Chilling with the systems, I'm like, oh hey, who's this with the neurons, spinal cord, and brain? Controlling everything I think, do, and feel.
That's the nervous system, y'all, you know the deal.
Chilling with the systems, I'm like, oh hey, who's this with the neurons, spinal cord, and brain? Controlling everything I think, do, and feel.
That's the nervous system, y'all, you know the deal.
Got it.
Right.
Now, what were you saying about the nervous system?
No, you're gonna have to rewind now.
I was like, well, I need a short one that doesn't take up too much time, but I don't know who makes these things. They're much more creative than me, probably. So the nervous system, there's two different, it's the central nervous system, which is like the brain and the spinal cord, and then the peripheral nervous system, which is the nerves that are outside of the brain and the spinal cord. And then the peripheral nervous system also has the autonomic nervous system. I always want to say automatic because that's the one that is like automatically controlled. Which the somatic is the voluntary. That's the one where you're actually, you're moving your muscles and doing different things. But the autonomic is automatic. You're automatically breathing and your organs are automatically moving. So that would be the autonomic. So the somatic is voluntary. So we have conscious control. If I want to like flex my muscles or walk, I know I'm doing it. And the autonomic is your internal organs. And the autonomic actually has two different sections too. The sympathetic nervous system, so that's like your fight or flight response. That's the people that if you have like some tragic thing, like you have to run from a bear, it'll actually give you the energy to run, because if it was me, I'd probably just like lay down and let him eat me, but
I give up.
like I can't run. But like something in your body, you know, lets out the adrenaline, and then you have extra energy, you have extra glucose and different things, and it's like your fight and flight response. And then parasympathetic is like the exact opposite. That's what allows your body to rest and relax. So nervous system medications are any medications that act on your central nervous system and your peripheral nervous system. Usually the synapse is the gap between the nerves, and usually they act on the synapse to adjust different messages by your neurotransmitters. So it's kind of like telling your brain that you're not in pain anymore, or you're not anxious. Same thing with like antidepressants. They all kind of trick your brain, I guess, if you want to think about it that way. It tells your brain kind of that you're not feeling that way anymore. And most medications that are nervous system medications do cross the blood-brain barrier, so they could have serious side effects. And your neurotransmitters are chemicals that help with the movement of messages across your synapses. So they're the ones, the neurotransmitters are the ones that are sending out the messages. So the peripheral nervous system, that was the one where I said it had the two different, the fight or flight and then the rest.
See?
Yeah, C, somatic and autonomic. And I always want to say automatic, but you could think of it either way. So then in the autonomic nervous system, like I said, it's like your fight or flight. So it's medications would be like adrenergic medications. That's a nerve cell that releases like epinephrine and norepinephrine. So it excites your body. There's two main neurotransmitters, acetylcholine and norepinephrine, that affect your autonomic nervous system. So these actually act like the norepinephrine, or they mimic the epinephrine or norepinephrine, or they'll help to stimulate the response of it. So it gives you that extra go for the fight or flight. And they're both actually naturally occurring substances. So you do have like norepinephrine in your body, but sometimes we need a little extra. So maybe your body isn't meeting the needs, or if you had like some terrible thing happen, if you were in shock, maybe you're bleeding out. An asthma attack would be another example of why you might need these type of medications. A lot of times when people are in shock, their blood pressure is like way down. So this can help to, it increases their blood pressure, can help open up the airway. It constricts your blood vessels, so that'll help you to stop bleeding too. And it increases your heart rate. So, but then the bad thing, it says use with caution because it increases your blood pressure. So say you're taking it for asthma, you have an asthma attack, well, it's going to raise everything up too. So if you already have high blood pressure, like asthma, one of the examples of the medications they give is albuterol. They give that all the time. Well, a lot of times that'll make people's heart rate and blood pressure go way up. So if you already have high blood pressure, they might give you another medication to help open up your airways. So that is just something to think about. But then like dopamine, that's a vasopressor, so it stimulates your smooth muscle contraction and narrows your blood vessels, which actually makes your blood pressure increase. So people that, you know, if they're like in ICU or an ER type of thing where they just can't keep their blood pressure up, they might have to give them like a dopamine drip through an IV or something to get their blood pressure going again. Oh, and then the other thing I wanted to talk about with that, there we go. the adrenergic agonist. So the difference between agonist and antagonist, agonist is something that activates that receptor and it causes action, where the antagonist blocks the action and it causes the opposite thing to happen. So if you're looking at the different types of medications, if you see something adrenergic agonist, that you know it's helping it. But if it says antagonist, it's doing the opposite. So hopefully that will help. So adrenergic blockers, they block the action of the adrenergics. So those are the ones that give you the fight or flight. So if they're blocking it, then that means they're slowing your heart rate down, relaxing your blood vessels. Sometimes they'll do that if you have like a really fast heart rate or an irregular heart rate, then they might have to give you something. Beta blockers, those are the ones for like high blood pressure. We're slowing that down. We're doing the opposite of what we were doing with the adrenergic medications. So usually, or BPH, that's another one they use that for. It just kind of relaxes everything. That's the one for the men that have like the enlarged prostates. It kind of relaxes it so they're able to go to the bathroom. So these medications were relaxing everything, slowing things down. So when you're in your fight or flight, you can't be like that forever. You're just going to kind of tucker out. So you don't want to be in that all the time. You want to go back to the resting state. That's when you might have to take medications like this. So the cholinergic agonists, those mimic the parasympathetic system. So the parasympathetic system was the one that slows everything down, relaxes everything. So sometimes they don't use this because it decreases your heart rate so much, or your kind of constricts your respiratory passages. So they might have to use that if somebody had like a dangerously high heart rate, they would use it, but like a normal person, they might not. And then another example of that, pilocarpine, they use it for glaucoma. Glaucoma is increased eye pressure is kind of what the glaucoma is. So if you take that medication, it allows the extra fluid to drain from your eyes and it releases the pressure. So you don't have the increased pressure. So anticholinergics or cholinergic blockers, like I said, I know it's a bunch of big words, but those inhibit the parasympathetic. So they don't, I forgot I had that picture on there. That's why you're laughing. Well, I remember when I was in nursing school, my teacher said this. She was like, because with these fight or flight ones, they kind of dry you out. So yeah, the side effects for it, you can't pee, can't see, can't spit, and can't shit or go to the bathroom. And I just think for some reason, like years later, I still remember her saying that. Like when I was like preparing for this, I was like, oh, what was that she always said? You can't pee, can't see. So I had to find the picture and stick it in there. So yeah, those are the side effects. It dries you out. So, and that's the opposite when you have, when you're helping the parasympathetic nervous system, then you have extra secretions and extra, so it's extra. With that, you're like going to the bathroom too much. So it's kind of opposite side effects. So like I said, you use it to treat like asthma, sometimes motion sickness. And then, of course, allergic reactions. That would be another one. Like everyone's probably seen or heard something about like a EpiPen. That would be another example, because the epinephrine actually helps to activate the parasympathetic, or not the parasympathetic, oh my gosh, the autonomic system. So the anticholinergics or cholinergic blockers block the acetylcholine and they decrease the parasympathetic nervous system. If you had a cholinergic crisis, symptoms of that would be like extreme weakness, respiratory depression, maybe you have too much acetylcholine. So that's why you might take something like a cholinergic blocker. It'll help open up your airway again. Okay, so this medication class mimics the sympathetic system. The adrenergic agonist, because it helps it. So then we have the analgesics, which that helps to reduce your pain because it helps you not to feel the pain. Salicylates help to relieve mild or moderate pain. They reduce inflammation and fever. Examples of that would be like aspirin or Bengay. That's a topical anti-inflammatory. The big thing with aspirin, we don't give it to young children because they could get the Ray's syndrome. So it kind of causes like confusion, swelling in their brain, and liver damage. So usually that's why we stick with like the Tylenol and the ibuprofen or Motrin for them, because of the Ray's syndrome. And it's rare, but it's not worth it, taking a chance. So Tylenol, that decreases pain and fever, but it doesn't help with anti-inflammatory. So that's why they usually say to like alternate the Motrin and the Tylenol, because the Motrin has anti-inflammatory effects, and then the Tylenol also helps with the pain and the fever. So, because you don't want to, you have so much that you can have per weight of the child, so you may need more than just the ibuprofen. And that's when you alternate with the Tylenol. And then if you add that to different narcotics, then it helps to potentiate their effect. So it helps them to work better. So that's why a lot of times they'll have Percocet has oxycodone and Tylenol. Or like the Norco has the hydrocodone and the Tylenol. So a lot of times you'll see that where they're combined together and it just kind of helps it to work better. And then NSAIDs, that's like your ibuprofen, Motrin, Advil. It helps to reduce pain, inflammation, and fever. And sometimes that can be combined with narcotics too, but you don't see it as much really. So oxycodone and ibuprofen, they can be combined together, but like I said, you don't see that quite as much. Usually it's the Tylenol. So now you could do like the Percocet and then alternate it with the ibuprofen too. And that's the other thing when, especially like the pain medications like the Percocet where you have the Tylenol and the oxycodone, you want to make sure if they are taking something over the counter to alternate it, it would be like a NSAID, like a ibuprofen, because otherwise they're going to take too much Tylenol. Because I think it's like now, it used to be 3 grams. I think now they prefer like 2 grams Tylenol a day. So if that has, say, 350 milligrams, and then if they were taking extra strength Tylenol, that would be like 1,000. So that'd be 1 gram already right there. So it'd be too much. So if they're taking like a prescription pain medicine that has Tylenol in it, you just want to make sure that they're not taking over-the-counter Tylenol on top of it. But you could suggest like an ibuprofen or something. So opium is from the poppy plant. Opioid analgesics are the stronger painkillers. They suppress your central nervous system. And usually the active ingredient is opium. So they can actually also decrease your blood pressure and your respirations. So that's a big thing that we usually watch when we give people, especially like the fentanyl there or the morphine. We always watch their respirations because it can decrease them. Especially at the hospital, we get problems where if people maybe take stuff before they come or take stuff out of their purse and then we give them medications, then it can really like make their blood pressure and their respirations go way down. So if I do give them anything like that, I always make sure I check their blood pressure and count their respirations before I give them anything too. And that can kind of help. And codeine is another example. And then, of course, another problem with all that is addiction. People, you know, they start out taking it because they legitimately have pain most of the time. And then if they take it for too long, then their brain just kind of is like, I want more, more, more. So they're getting really strict about, like, when they order stuff like that, how long they can even give it to people for. Because we don't want anybody getting addicted. So, which of the medications has no effect on inflammation? Yep, Tylenol. So that's not, it's going to help with pain and fever, but not inflammation. The rest of them will.
Which one?
Yeah. Salicylate is like your aspirin, so that does help with inflammation. NSAIDs are like your ibuprofen, Motrin. And then ibuprofen's down here too. So, yeah. Tylenol does not. So then you have the medications that help with anxiety, insomnia, sedation, seizures. Sometimes if your limbic system of your brain isn't working correctly, then you might have problems with anxiety or seizures. You have anxiolytic medications. Those usually can help to relax you, kind of reduce your fears. Examples would be like lorazepam or Ativan, Xanax, something like that. And they just kind of calm you. And then Valium, that would be another one. Valium or diazepam, that's one that they actually can use sometimes with people with seizures too. Kind of helps to relax everything. And then benzodiazepines are another type of medication that help to treat anxiety, alcohol withdrawal symptoms, and they just kind of help to relax your muscles. And then you have the medications that help with sleep, like Ambien, Lunesta. Problems with that is sometimes people don't even remember like getting up and driving, or you know, they have crazy dreams. Those can also help to slow your heart rate and your respiration. So that's kind of scary because when you're sleeping, you kind of slow down anyway. So they can definitely help people that are suffering from not being able to sleep at night, because I know that has got to be hard for people, but then they also have different side effects that we have to kind of watch out for. And sometimes they'll give them to people to relax before a minor procedure or surgery too. And then also you can get risk for addiction with those, so you just have to be careful. So barbiturates and anti-seizure medications, those help to control seizures. They delay the sodium from crossing your neural membranes. So it decreases the potential for too much electrical activities and just kind of calms your cells down. So an example of that would be like Dilantin. That's a pretty popular one they use for seizures. And that helps with like the grand mal or tonic-clonic. That's the big seizure that your whole body's kind of jerking around. And then also partial seizures too. And then another one, a barbiturate, would be phenobarbital. That's also used for tonic-clonic, which is the big seizure, or like a febrile seizure. So kids usually, we try not to get their temperature any higher than like 103.5, because any higher than that, then you start risking having like a febrile seizure. So that would be a medication they might have to give somebody if they had a febrile seizure. And then the other, so you have the barbiturates, and then you have the succinimides, and those delay the calcium from moving over the neurons, and that's how that helps to relax your cells. So that's for the petite mal seizures, the ones that aren't quite as big. So let's see, I thought I had an example of those. Like Zerontin is actually the example of the medication. It's like I knew I had it somewhere. Okay, so medications that can treat anxiety, insomnia, sedation, seizures. Again, like I said, the barbiturates, anti-seizure medications. Then you have the GABAs, the gamma aminobutyric acid, which say that 3 times fast. Yeah, thank gosh they have example, or I mean that they abbreviate things. So it helps to decrease seizure activity. An example would be like that Sabril. And then you also have benzodiazepines like Valium. That is another one they give for people to relax everything. And that actually intensifies the effect of the GABA or gamma aminobutyric acid. So you could give those together, the Valium with the Sabril. And it helps to intensify the effect. Other anti-seizure medications, Lamictal, that's one that you see a lot. Topamax, that Tegretol or Gabitril. All of those work as anticonvulsants, and so then those actually reduce the seizure activity too. So they just have it. Sometimes it's trial and error with that for people as far as what works for them. Unfortunately, sometimes if one thing isn't working for them, then they'll switch them to something else, or if it's causing too many side effects, then they'll maybe pick something that doesn't have the same side effects. So then you have the CNS stimulants. Those are the ones for like the ADHD or the ADD, and the big symptom for ADHD or ADD is impulse control. People that have a really poor impulse control. I can say that from experience because I have a child with that, and they don't think before they do things sometimes. They just go, 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 or just react to anything. So, and then also just the concentration to kind of slow down and kind of concentrate on what you're doing. So it's kind of weird because like you hear about people abusing these medications to help them be like stay awake and be more alert, and then it kind of, because it's a CNS stimulant, but then for those that have ADD or ADHD, it helps to slow them down and make them concentrate. But people that don't have it, it stimulates them. So it's kind of weird how the brain works like that. But examples of that is like Adderall, Ritalin. You do see Ritalin sometimes, but not as much as you used to, like way back when I was a kid. I think that was like the only medication they had. But I think they try to do more of the Adderall and like Concerta and different things like that now. And then amphetamines like Phentermine, that's a popular medication they give people for obesity. It helps them kind of controls their appetite and helps to increase their metabolism. And that phentermine at the bottom there. Yeah. So usually they take it like 30 to 60 minutes before they eat because it helps them to like metabolize their food quicker. And I know I'm like, man, I need to go get some of that. But
I don't think they give it to you. That's
and the other thing with that is they will like test people really close and watch people really close with their heart rate because it can raise your heart rate up too. So that's one thing they look at with that before they do give it to people. But I think it works really good when people are on it, and then when they go off of it, then it's not doing its job anymore. And so diet and exercise, that'd probably be the best. As I'm drinking my Mountain Dew. So different medications for mood disorders, antidepressant. So if you're we were just going over different neurological stuff yesterday for the CNA, and like the treatment for every single thing I said was medications and therapy. She's like, you just want to give everybody medicine. But sometimes people need it, you know, if you're feeling depressed. So there's lots of different kinds of antidepressants. Clinical depression is characterized by usually you sleep more, you eat more, you can't concentrate. Sometimes you avoid the companionship of others. You don't have interest in activities like you used to, and you just feel kind of in despair, I guess. You just down, and sometimes people can really hide that well too, but that's kind of what they characterize it as. So you have 3 different categories of antidepressant medications. The first one they're talking about is the MAOIs. And again, I like the abbreviation because I don't want to have to say monoamine oxidase inhibitors. Yeah. So it inhibits the enzyme that so it terminates the action of the neurotransmitters at the synapse, so it inhibits the action and it improves your retention, so it helps you to not be so depressed. Sometimes you might have to have special dietary considerations, like any food that has that tyramine in it. And then an example of an MAOI is that Eldepril. That's one of the medications.
Is that for disorders?
Sometimes they do use those kind of for both. Its main use is an antidepressant, but sometimes it can kind of help with both. And then the tricyclic antidepressants, those are sometimes if people have like, those are the 3-ring chemical structure antidepressant, so it keeps your norepinephrine and your serotonin, and it usually is what they use if you have insomnia. So amitriptyline, Elavil, that's one that you see a lot, and that actually they use that for rest too. So sometimes you'll have people say, oh, like if I'm like, oh, I have your antidepressant. They're like, no, I don't take it because I take it because it helps me rest too. So sometimes that's another one where it's an antidepressant, but can be used for other reasons too. And then the SSRIs, those prevent the serotonin from being used up at the synapse. So they don't have as many side effects. So usually they use those first. And some examples are Celexa, Prozac, Paxil, or Zoloft. And your serotonin is the chemical produced in your brain that acts as a neurotransmitter. So if you have low levels of serotonin, then that's one of the implications of depression sometimes. So if your serotonin is low and that's why you're feeling depressed, then that's why they're going to give you that too. And those are probably the more common ones that you see, and that's just because they don't have as many side effects and they usually work pretty good. All of the antidepressants, the other thing with those are they usually take longer to take effect. So they're not going to like take it and see effects that same day. It's going to take a couple weeks. So hopefully some people, the problem is they'll take it and then they're like, well, I don't feel any different, and stop taking it. You have to give it time, let it work. So the SSRIs, they block the reuptake of serotonin and norepinephrine. And the increase in levels of serotonin and norepinephrine help to elevate your mood. They make you happier. They make you kind of more upbeat. And different examples would be like the Effexor, Cymbalta. Those two are pretty common ones. Then you have the mood stabilizers. One of the common ones like lithium. They also have to do different blood draws with that pretty frequently because they can be toxic. So, and actually lithium toxicity is can be fatal. So they help with, you know, stabilizing your mood, especially people that are bipolar. Those are the people that are like manic, where they're really up, you know, go, 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 happy, and then they're depressed, where they're way down and sad, and they just helps to kind of stabilize everything out. But you just have to kind of be careful with those too. And people that are on lithium is actually a salt. So first of all, you want to make sure that they're drinking lots of water so they don't become dehydrated. And then the other thing, you want to have them avoid taking extra salt in their diet, which is of course hard because there's like salt in everything, but just kind of things that they need to avoid that have high salty things, like usually lunch meat has a lot of salt in it, soups have a lot of salt in them, so you just kind of want to avoid taking in too much salt, because that can actually have too much salt in their body since it is a salt. Different signs of toxicity would be blurred vision, confusion, sensitivity to light, muscle weakness, seizures, and even like a coma. So kind of a big deal. So then you have your antipsychotic medications. Those help to treat different abnormal actions and behaviors, such as talking and interacting with situations that only they can see or hear. So that'd be like hallucinations. If you're seeing and hearing things that nobody else is, it'd be like a visual or an auditory hallucination. And then sometimes they use it for other effects too, like nausea, vomiting, but that would be like a severe case. Like they wouldn't just jump to the antipsychotics for that. If they take other anti-nausea medications and those won't work, then they might do something like this. And then the big thing with the antipsychotic medications, one side effect is tardive dyskinesia. And that's when you have like the involuntary muscle movements. So you're kind of like, a lot of times their mouth will be kind of twitchy, or their arms. And that's usually if you've taken it for like a longer period of time. And it's not reversible. So we watch that really close. And I think like the newer antipsychotic medications, like Zyprexa, they're getting more towards like using those because they don't have the side effects like this Thorazine. The Thorazine has the thoradazine and the clopine, they all have a side effect for the tardive dyskinesia. So you really want to watch for that. And then different symptoms of people are feeling, or symptoms of psychosis are like hallucinations, like we talked about, paranoia. Sometimes they think everybody's out to get them, or, you know, they're always looking out their window, my neighbor's going to kill me. You know, just, you know, things that don't make sense to other people. Bizarre thoughts and behaviors and delusions. So, I just answered this. Abnormal thoughts, disorganized communication, and lack of interaction with the environment, that would be psychosis. Yep. So dementia it's progressive and it's irreversible, and it just keeps getting worse, and it's a decline in your mental function. Alzheimer's is probably the most frequent case of dementia, but there's lots of other kinds too. I've seen where people had like vascular dementia, where they just didn't have the blood flow to their brain like they should. I've seen alcohol-induced dementia, where maybe people were alcoholics and that kind of caused the dementia. So there's lots of different kinds, but Alzheimer's is probably the one that you've heard the most. And so yeah, everybody with Alzheimer's has dementia, but everybody with dementia doesn't necessarily have Alzheimer's, if that makes sense. It's just one form of dementia. And so the medication they give you helps to slow down that deterioration, but it doesn't cure it. It's not going to make it any better. So I actually went to like a seminar once, and the person said, well, we should really be taking these medications before we ever have symptoms, because by the time you start having symptoms, then it's too late to go backwards. So I thought that was kind of interesting. It just kind of helps to slow down what's already happening. So Aricept, that's a big one that they usually give people that have dementia, and it helps to slow down the progression. Kind of helps, I always kind of say, oh, that's your memory pill, because it kind of helps them to kind of keep that, what they have left, I guess. And then another degenerative disorder of your brain or central nervous system is Parkinson's disease. With Parkinson's, your neurons that produce your dopamine die, and so your muscle movements are all disorganized. So those are the people that have like tremors, you see, kind of. Another thing, balance problems. They usually, when they're walking, they have kind of like a shuffling gait. That's another big sign for Parkinson's. Their muscles are kind of rigid, and they just move slower than everybody else. So they need more patience, take more time to do things. So the medications we give them are called anti-Parkinsonian drugs, and usually they help to keep the dopamine and the acetylcholine. So it helps, and actually, usually that's how they diagnose Parkinson's, by giving them these medications. And if they work, then they know, okay, well then that must be what it is usually. So it's kind of interesting. If it doesn't work, then they try other things. But Cinnamate, that's probably the most, or Requip, usually they'll take both of those kind of. The Cinnamate, usually they'll take it like at least 3 or 4 times a day. And then the Requip, take a couple times a day too, and just kind of alternate. And you can definitely tell if somebody misses that, they can tell too, like all their symptoms kind of come back, get worse. So also, I think the reason why some people take more is the more you're on it, then and the more your disease progresses, then the more you need. So if people are, maybe saying that they feel like their symptoms are increasing, then we can let the doctor know, and they might increase their dose. Or sometimes they have new medications out there too that they can add in, or switch it to that can help. And like I said, sometimes they need a combination of the drugs to help to get those dopamine levels where they need them to be. And then a drug holiday, that's when maybe they'll stop taking the medications for a little bit and then they'll restart them at a lower dose. So if you can't increase the medications and the side effects are intolerable, then they'll order a drug holiday, and maybe the patient will stop taking that medication for like a week and then restart it at a lower dose, and it'll actually start working again better. So it's kind of interesting how that works. So then local anesthesia or anesthesia medications. The main goal for any type of anesthesia is to stop that sensation so you're not feeling the pain for whatever they're doing. The Imla cream, I know you guys were talking about that. You learned about that in phlebotomy. We put that, usually kids a lot of times, and it helps to numb that area. So if we put like an IV in or we draw their blood, it doesn't hurt them so bad and it's not quite so traumatic. Sometimes they'll use like a aerosol spray. For your eyes, you could do like a benzocaine. Injectable would be lidocaine. They can inject that. Usually that's like when we get our teeth done. If we have like our teeth pulled or anything done with our teeth, that's they'll inject that. And then there's two different classifications. The amides last longer and they don't have as many adverse side effects or allergies. And then the esters have the potential for severe allergic reactions, and so usually those are just topical. They're limited to more topical. And so anesthesia, that can be like if you were to go to surgery and have anesthesia, they could put it through the IV or you could inhale it. That's usually what we always see them doing like on TV, is they're inhaling it in and counting backwards. And different examples of those would be like Versed or ketamine. And those just help you to kind of relax so they can do what they have to do without you being traumatized. And that, I guess, was what I was getting ready to talk about. So the anesthesia actually creates loss of feeling and consciousness. So the Versed or the ketamine are both for like IV, whereas the inhalation, sometimes that also works the same as far as you kind of have the loss of consciousness and feeling, but you're inhaling it instead of taking it through the IV. And if you do the IV medications, usually you can take lower doses of the inhalation therapy, so you don't have as much of a risk for side effects. So sometimes you can do both, kind of a combination of the IV and the inhalation. And you just have to be careful because they can depress your respiratory and cardiovascular function too. So that's another thing why they have like that anesthesiologist. They always have that in this in every surgery, and that's their job, is just like watching you and making sure your heart rate's good, your respiration, which you're going to be intubated, so that's already covered there. And that's why they intubate you before they start any surgery or anything, because that takes care of your breathing. But they watch your heart rate and how your body's reacting to that medication, and they can turn it up or down depending on your weight. And yeah, those are the quick math people. I know I had to go watch a surgery, and it was like 6 in the morning, you know. Probably didn't have any time for coffee because I was like trying to get there at 6 a.m. And he's like, so I walk right in, he's like, so if I have a patient that is this many kilograms and I'm going to give them this much medication and it's this per kilogram per blah, 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 how much would I give them if they're breathing this fast and this is their respirations and their blood pressure and their heart rate? I'm like, okay, wait, hold on. Let me write this down. But those people, that's how they think. They don't have to write it down. They just, yeah. That's why they make the big bucks. But, yeah, so the last thing that we have with the nervous system is alcohol, because that depresses our nervous system and it interacts with lots of different medications. And if you use it too much, it will damage your central nervous system and your liver. So different things that can cause confusion, increased heart rate, decreased motor coordination, unsteady gait, slurred speech. So that's kind of why when, say, if somebody was to get stopped by a cop, how now they do like the breathing mostly, but they used to do like basically a neurological exam is what the cops were doing. That's the same thing we do if we're testing people's neurological, their different nerves, is what they were doing, where they're having you kind of go like that, make sure that your nervous system is working correctly, and you're like, oh, okay, you must be okay to drive. But if you can't do all those funny things like walk in a straight line and touch your finger to your nose, then they were like, nope, you've had too much alcohol, your neurological system is not working correctly, you're going to jail. So, yeah. So different signs and symptoms of alcoholism is irritability, tremors, especially if they're a chronic alcohol person and they haven't had alcohol for a while. That's when they start having the tremors. Frequent falls, blackouts, they drink so much they can't remember anything, confusion, muscle weakness. Treatment, usually they do like a behavior modification, so they're going to go to some type of therapy, or like the AA, how they kind of walk them through the steps. They always do the vitamin B. That's one that they do. Maybe some dietary changes, and they might have to take medication to kind of help with that too. And then if you did drink too much alcohol, then it would eventually damage your nervous system and your liver. So that would be something to avoid. I feel like I never give you guys the break you deserve. So if you guys want to take a break, and then we'll talk about chapter 14. It's just, it goes so fast for us.